Good afternoon, my fellow Coloradans. Today is Election Day. Please make sure to turn in your ballot at a local drop box or polling station. It's too late to put it in the mail, so please put it in an official drop box prior to 7 p.m. or at a local polling station. If you've lost it, can't find it, you can go vote at a local polling station until 7 p.m. Our school boards, city councils, statewide initiatives, in many areas, local initiatives, are all being decided across our state today. Make sure that your voice counts. We continue to be impacted with the COVID crisis in Colorado. Colorado has risen to become the 5th highest state for COVID rates at this point in time. It's hitting our region very heavily. It would be worse if we didn't have 80% vaccinated, and we're going to get into the amazing impact that the vaccination is having protecting lives. Just as a preview to that, the vaccine can significantly, almost entirely reduce your risk. During this COVID period of the Delta variant, July, August, September, October, we haven't lost anybody under age 40 who's been fully vaccinated. And the vaccine for those who are 40 to 60 has also shown to be 95% effective at preventing death. So the pandemic can be over for you when you choose to be vaccinated. And more Coloradans are making that choice every day. And we're very grateful that while we're doing better than some other states, we have a very high level of COVID transmission in Colorado right now, 5th highest in the country. 1 in 51 Coloradans are contagious with COVID as we speak. That means that if you are unvaccinated, a regular trip to the grocery store, a night out to dinner, are more dangerous than they have been at any point in this pandemic for you if you are unvaccinated. And I want to make sure Coloradans know that. The Delta variant is brutally effective at seeking out the unvaccinated, like a laser-guided missile, infecting them and often killing them. It's never been more dangerous for an unvaccinated person than it is right now. And of course, our mitigation tools are important. With 80% of Coloradans vaccinated, the fact that we're able to have infections at this rate, our hospitals filling up with the 20% of people who aren't vaccinated, really just shows how much of an impact that the unvaccinated minority is having on the rest of our state. If you are fully vaccinated, I encourage you to get a booster after 6 months for Moderna and Pfizer. I did, you should. And if you got Johnson & Johnson 2 months or more ago, please get a booster. They all work in combination. The data is clear. You can get Moderna, Pfizer, whichever you prefer. And the best way to protect yourself by far is to get vaccinated. You'll hear about some of the other steps we're taking, promising impact of monoclonal antibodies and how we're rolling those out to more folks. But nothing is as effective as the simple vaccine. And it's never been more dangerous to be unvaccinated than it is right now. If you've been vaccinated already, get that booster. It's a good idea to wear a mask around others indoors. But the vaccine is so amazingly successful at preventing deaths and hospitalizations that we have the tools to end the pandemic. We are also very excited about anticipating CDC approval for vaccinating 5 to 11-year-olds, hopefully as soon as later today. I'm the father of a 10-year-old and a 7-year-old, and I'm excited that they will be vaccinated in the next few days. I encourage all parents to get their kids vaccinated as soon as that becomes available. And if you're a parent of somebody 12 and up, please get them vaccinated right now. We increased in hospitalizations by 18 at 1,254 hospitalizations. Over 80% of those are unvaccinated in our hospitals. And I want to make sure you understand this. 80% of the people hospitalized are unvaccinated. That 80% comes from about 20% of the population. So the effect is even far greater than that. It's much more than just that 80%. It's, as I said, the Delta variant is brutally effective at seeking out the unvaccinated, infecting them, sending them to the hospital, and tragically killing many of them. The bright side, the good news is we have a highly effective vaccine. When I signed the FedEx slip for the first vaccines last year, it was the most exciting moment of my life when I thought about the lives that would be saved. Never in the back of my mind did I ever think there would be so many Coloradans who wouldn't take advantage of this triumph of modern science. And for those who are still alive and haven't been vaccinated, here's the message. It's not too late. Get that first shot, get that second shot, get protected, end this pandemic and substantially end the risk for yourself, right? Nothing is zero risk, but once you reduce the risk 90, 95, 98%, it's within the normal parameters of everyday living. And our hospitals are no longer full, and it's no longer a crisis, and it's no longer a pandemic. We have the ability to end the pandemic. We need the will to end the pandemic. There are 27 kids hospitalized. 20 of them are 0 to 11. And very sadly as well, 7 of them are age 12 to 17. And why do I say sadly? It's because 0 of those 7 kids that are 12 to 17 who are hospitalized or vaccinated. The vaccine is about 100% effective, very close to 100% effective at preventing hospitalizations for young people. And there's simply no need that those 7-year-olds are in the hospital, missing out on so much. Many will take weeks or months to recover. I certainly hope they all make it, but being hospitalized is no walk in the park, even if you do make it out after days or weeks. Now I'll turn it over to more detail about where we are from an epidemiology perspective to Dr. Rachel Herlihy, who you, as seen on television, you might have seen her on television recently imploring Coloradans to get protected, and Incident Commander Scott Bookman. First, I'll turn it over to Dr. Herlihy. Dr. Herlihy?
Great. Thank you so much, Governor. Good afternoon. All right, so I want to provide you with an update on our case and hospitalization trends here in the state, like we usually do, but also spend a little time talking about some of our hospitalization projections as we see our trends continue in the unfortunate upward direction. So this is a slide that is showing you our case trends, our 7-day moving average shown in red there. The last couple of weeks, I've been sharing data with you and talking about this high stubborn plateau in cases that we've had. Unfortunately, in the last 2 weeks or so, we have seen a pretty rapid acceleration in our cases. And you can see that with the steepness of that red line at the far right end of this figure. So again, an unfortunate increase that we're seeing here in Colorado right now with an acceleration in cases, which we know can potentially lead to an acceleration in our hospitalizations as well. Next slide, please. As the governor mentioned, Colorado does unfortunately have some of the highest rates in the country right now. So we, based on the CDC data, appear to have the 5th highest rate in the country right now, and our rates are continuing to increase. Also, one of the trends that I noted in the last day is that the US trend, which had been going down, so we had been seeing a steady decline in US cases overall, does seem to have flattened a little bit and actually perhaps looks like it might be increasing once again in the US overall. So again, Colorado's rates higher than most states in the country right now, but we are seeing the US start to see at least the early signs of an increase in cases as well. Next slide, please. Next, I want to show you some regional data in the state. So as always, throughout the pandemic, we see quite a bit of regional variability. Certain counties or regions of the state tend to have higher rates than others. We know that a lot of that association with case rates has to do with vaccination rates. We tend to see lower case rates, hospitalization rates, and death rates in our counties where we see our highest vaccination rates. But looking across our largest Colorado counties, you can see that most of them at this point are seeing an increase in cases. So you can see here our 12 largest counties on this slide and then the next slide. And I want to point out specifically Pueblo County, where really in the last week or so, we have seen this pretty rapid increase or acceleration in their cases. And one of the things that we are seeing in Pueblo is an increase in cases among adults. We know that the vaccination rates there are lower than they are overall in the state. And that does concern me that there could be an increased risk of increasing hospitalizations in Pueblo County. We know they're seeing some of that already. But as that rate continues to accelerate, we are certainly worried about the number of hospitalizations that could occur among the unvaccinated population in particular in Pueblo County. Next slide, please. So overall, the last couple of days, we have continued, unfortunately, to see an increase in our overall number of hospitalizations here in the state. So as of November 2nd, today, we have 1,254 Coloradans that are currently hospitalized. That is the highest number that we've seen in Colorado since December 20th. So the highest number that we have seen so far this year. Next slide, please. I want to talk a little bit about vaccine effectiveness. And the governor mentioned this, the incredible protection that we are seeing from vaccine, protecting individuals against hospitalization and death. So these are updated numbers for you. So this is looking at cases that have occurred in the state since July and looking at the overall vaccine effectiveness that we're seeing by age group for hospitalizations and then for deaths. And as the governor mentioned, you see that 100% value for the 12 to 39-year-olds, meaning that we have not seen any deaths occur among that 12 to 39-year-old population among vaccinated individuals. Overall, you do see that the numbers are quite high here. So effectiveness numbers in that 94, 95% range, really for most age groups here for both hospitalizations and deaths. We do start to see that waning immunity effect in older Coloradans. So you can see that vaccine effectiveness does decrease a little bit as our age goes up in the hospitalization data, with that lowest level of vaccine effectiveness associated with our 80+ population. And then the same trend holds true with the death data. And again, this is a really important reminder of the impact we are seeing waning immunity occurring in our community and the importance of booster doses and really bringing those immunity levels back up and protecting our most vulnerable individuals. So again, booster doses eligible to many adults in Colorado, but especially important for our older Coloradans. Next slide, please. I want to talk a little bit about hospitalization trajectories and where we might be headed over the next couple of weeks. So this is a figure that shows you what we could potentially expect for the number of hospitalizations that might be needed in the state, depending on whether we stay on our current trajectory of transmission in the state, or if we were to potentially see a 5% worsening of transmission control. That 5% worsening of transmission control could be associated with things like less mask use or things like more gatherings, just with individuals changing behavior as the weather cools and moving indoors. So it's certainly a possible scenario that we could see. And so what you see here is that if we stay on our current trajectory, we have a potential peak in hospitalizations that occurs in late November, early December, and that peak is around just about 1,500. If we see a worsening in transmission control, that number gets closer to 1,900 in the state. And to put this into perspective, based on the current number of beds we have available in Colorado, plus the number of patients that are currently hospitalized for COVID-19, we think that maximum capacity is probably around 2,000, meaning if we see a worsening in transmission control in the state, that could certainly significantly hamper our healthcare system's ability to care for our most severely ill patients. Next slide, please. Director Bookman is going to go into more detail to talk about the important role of monoclonal antibody therapy in protecting Coloradans, especially the role of monoclonal antibody therapy in protecting our hospital capacity and preventing hospitalizations. So this is some data that our team pulled together to try and understand the potential effectiveness of monoclonal antibodies in trying to decrease the number of hospitalizations that we could see here in Colorado. And based on the analysis that we've done, we do see that there could potentially be a significant impact of monoclonal antibodies in decreasing the number of hospitalizations. We're estimating that at the peak of our pandemic in late November, early December, we could potentially see 200 to 400 fewer hospitalizations at that time. Of course, monoclonal antibodies are not going to have the level of effectiveness of vaccination, but they certainly are a really important tool, especially at this point for individuals that are unvaccinated and also vaccinated individuals that might be at risk of severe disease, ensuring that those individuals are protected from hospitalization. And with that, I'll hand it over to Director Bookman.
Thank you, Dr. Herlihy, and thank you everybody for joining today. Next slide, please. And I really, before we talk more about monoclonals, want to just reinforce again that we continue to see the pandemic of the unvaccinated in our hospitals. And while we'll talk about monoclonals here, the most important thing that people can do to protect themselves from being hospitalized is to get the vaccine. It's free, it's safe, it's effective, and it is the ticket out of the pandemic. But what we are learning, and I think what we are seeing nationally, is a greater understanding of the potential role that monoclonal antibodies can have in preventing hospitalizations. And as we see our cases and our hospitalizations go up, we want to make sure people are aware of these treatments and who may be eligible. So this is a new type of treatment. It is available under emergency use authorization and provided to us by the federal government. And here is who is eligible. If you are an adult or pediatric patient over the age of 18, you have tested positive for COVID-19, and you are experiencing mild to moderate symptoms prior to the need for being admitted to the hospital. Additionally, you must be within 10 days of having experienced the onset of symptoms of COVID-19, and that you are at higher risk for having more serious symptoms of COVID, including underlying medical conditions. And so in the next slide, I really want to show everyone who is eligible for this based on those underlying medical conditions. And what I want to emphasize is this really is a broad segment of our population who may have these risk criteria for qualifying for the monoclonal. So age over 65, being obese or overweight, pregnancy, diabetes, sickle cell, lung disease, heart disease. These are all conditions that would make you eligible if you meet that initial criteria for receiving these monoclonal antibodies. And so, for the public, for our providers who are listening, really important to understand what this eligibility criteria is. Next slide, please. So as the national understanding of the potential impact of these monoclonals has evolved, we are really working to scale our ability to provide monoclonal antibody treatment within the state of Colorado. Today, we already have 161 providers enrolled across the state. On this map here, you can see where these providers are located and that they are different types of providers so that people have the ability to get them at hospitals, pharmacies. We have access in our long-term care facilities and our skilled nursing facilities. And then, we have public pharmacies, urgent care. So we would love more urgent care facilities to join us in this effort. And then we have infusion centers and mobile providers. Additionally, yesterday, we launched our monoclonal antibody bus program. We have 2 buses that are working this week. We have 3 more buses coming online next week. Currently, those are referred by a provider to ensure that we're getting the right patient to these buses, though we are working on streamlining that process as well. To ensure that members of the public who have a positive test and then identify themselves as being, eligible, are able to schedule themselves for an appointment. Additionally, we have reached out to our federal partners to see whether there are any additional federal teams that can come in and support our efforts here. And that formal request went in this morning, and we'll be working with our federal partners to get resources on the ground to provide additional scale in that work. And then finally, just want to point out on the bottom here is our website where people can go to learn more about monoclonal antibody treatment and even to register for an appointment. So with that, I'll turn it back over to the governor.
Yeah, thank you. So we're trying to raise awareness about monoclonal antibodies. What's important is you need to be tested and identified with COVID. It is too late after you're hospitalized for COVID. They might give you steroids, they might give you other treatment, but this is early in the course of infection, mild to moderate symptoms, and you're older or at risk. This can reduce the likelihood of you being hospitalized by 70%. It's not as effective as the vaccine, right? Get vaccinated. It's the best protection you can have. But if for some reason you haven't gotten vaccinated, you get sick, you're at risk, this is another step that we are making available more broadly and getting the word out about the advantages of this. But it doesn't do any good once you've gotten COVID and you haven't gotten tested, or you think you have it and you don't want to be tested, you don't want to know you have it, and all of a sudden you're in the hospital. That is not who gets monoclonal antibodies. They don't do anything at that point. You might get steroids and other treatment. You might make it, you might not make it. They reduce your likelihood of having severe COVID when given early in the course of infection. which is yet another reason if you're experiencing any symptoms, get tested in the first day. When you're sick, get tested, right? For not just for that peace of mind, not just to alert your friends and family if it's COVID, but also because there might be an effective treatment for you, monoclonal antibodies, that could reduce your risk of hospitalization by 70% or more. And that's the word that we're trying to get out today when 1 in 53 Coloradans are contagious with COVID. You can all find more information about a community testing site at covid19.colorado.gov/testing. They're widely available all over. You can sign up to get Binax at Now at Home, but that's not the symptomatic testing. You should get symptomatic testing at any of our hundreds of sites across the state. And before we close, I also want to emphasize the importance of boosters for folks who got the first 2 doses. The data shows a decrease in the protection level around the 6-month mark. I'm 46. I got boosted 2 weeks ago. And by the way, it didn't, unlike the second shot where I was a little tired the next day, I didn't even feel anything the next day. I felt better than usual. Some people have the same types of, symptoms, or a little tired the next day, whatever it is, but it's half the dose of your first and second dose for Moderna and Pfizer. If you've been putting it off, with the prevalence of COVID-19 in our state right now, get that booster. If you got Moderna or Pfizer 6 months or more ago, if you got Johnson & Johnson 2 months or more ago, you will benefit greatly from that increased level of protection. They're available anywhere you can get first or second doses, the mobile stations, your pharmacy, hospitals, doctors' offices. And of course, if you're the parent of a 5 to 11-year-old, I hope you're making plans as we are to get your kids vaccinated in the next few days. covid19.colorado.gov/vaccine. As we approach the holidays in cold weather, we all need to be careful to protect ourselves and our family. If you're unvaccinated, you know what you need to do. It's time to quit procrastinating. Roll up your sleeve, get it over with, get it done, protect yourselves, and make sure that you too are able to enjoy a Merry Christmas and a Happy New Year as the rest of us will. Thank you, and happy to take some questions.
The first question we'll have is from Meg Wingerter from Denver Post. Meg, go ahead.
Hello, thanks for taking my question. Looking at those projections of where the hospitalizations could be heading as is, or with a 5% reduction, those both look like potentially pretty bad scenario. A bit about how you're going to decide whether to take any further steps if we continue along those paths?
Well, we have just took, as Scott announced, the calling in the FEMA teams, and he can update you exactly where the paperwork was on that. But we've done all 5 things that we talked about last week that we might need to do if cases need to increase. So we have, even at that point, we talked about rapidly expanding monoclonal antibody access. Of course, part of that is on us and on providers, but part of that is on you and patients for testing early and seeking it out, right? Because it's not for people who are already so sick they're hospitalized. It won't help at that point. We have also issued the public health order around freeing up hospital workers to work in emergency rooms for COVID and non-COVID causes, and continuing to work to surge our health care workforce, and hopefully continue to get through this. As you can see with the projections, it's going to be tight. It is tight. It's going to be tight the next few weeks. And that's why we really encourage everybody to get vaccinated first and foremost. And that if you're not vaccinated, this is the most dangerous time in the entire pandemic for you. And so please be extra careful, wear a mask, avoid others. About 1 in 50 people you come in contact with are going to be contagious with COVID. And the best way that you can protect yourself is to get vaccinated.
I'm sorry, could I just clarify?
Sure.
When you said about the public health order as it related to staffing, is that crisis standards for staffing, or what exactly are you referring to?
So that it was around the delaying of cosmetic surgeries went in, and then the formal authorization for the crisis standards of care to be implemented as they were they were implemented through much of this pandemic. They will likely need to be in place again to make sure that patients that benefit the most from help get help. The other one that went in was the rerouting of patients to hospitals that have capacity. because even though we're at about 90%, there's some hospitals at 98% and some at 85%. And so we are going to be more active in making sure that patients get routed to hospital beds that are available and open for them. And that's what that was the contents of that executive order on Sunday, the accompanying healthcare order, and we will provide those to you. I'll make sure our media team gets those to you.
Thank you.
Governor Chris Vanderveen with 9 News. This question can go to anyone who wants it. According to the New York Times, a good chunk of the hospitalization rises right now are really being driven by 70-year-old plus people showing up in hospitals, a group that is heavily vaccinated here in Colorado. So the first question is it clear now that the effectiveness of the vaccine is waning in that particular age group? And what's missing right now for the roughly 2/3 of the people? What's the message for the roughly 2/3 of the people who are over the age of 70 who have yet to receive a booster? What's the message for them, knowing that a lot of folks are ending up in the hospital that are 70 plus?
Yeah, Chris, and let me answer your question more succinctly in a moment, but I want to address something in that first. So looking at the Delta period, July through now, I don't have these numbers in front of me, Chris, so we'll give you the exact numbers, but I'll use sort of approximations from my memory here, and we'll get these to you. I believe we were talking about 70 and up. It might have been 80 and up. And we had about 200 deaths among the unvaccinated and about 100 deaths among the vaccinated. And we'll get you these exact statistics. But what I want to emphasize there is the vaccination rate is very, very high for 2 doses among 70 to 80-year-olds. We'll get you it, but let's call it 95%, 93%, right? Higher than the average. So the fact that 200 deaths occurred from that little sliver of 6 or 7% of the population, and then 100 deaths occurred from that much bigger 93%, does, of course, reinforce your question that yes, people are still at risk after 2 doses, and we'll talk about that for 70 and 80-year-olds in my more succinct answer. But it also shows how much more extreme the risk is if 2 out of 3 deaths were from that little sliver of 6 or 7% of the population. So I'm going to get you the exact numbers to fill in on that, Chris, for your own analysis. They're pretty close to the numbers that I just articulated, and we'll get that to you within a couple hours. Getting back to your other question, the effects of the booster are incredibly strong. There was a recent meta study done out of Israel, over 1 million people total, that showed an additional significant reduction in hospitalization risk in excess of 90% between people that had 3 doses and people that had 2 doses. The protection wanes quicker for people in their 60s, 70s, and 80s. Everybody in their 60s, 70s, and 80s who had the vaccine, Pfizer, Moderna, Johnson & Johnson, 6 months or more ago, should immediately get boosted to protect themselves. And it is also a very smart thing to do for people in their 30s, 40s, and 50s. I'm 46, didn't hesitate a moment, got the booster, and frankly, I'm thrilled that me and my family will have that additional level of protection.
Governor Polis, Sarah Flower with KSUT, Four Corners Public Radio. I have a question for Dr. Herlihy, too. As far as the science, with 80% vaccinating, you touched on this a little bit with the waning of vaccine efficacy at this stage. But what is the science showing us at this juncture with 80% being vaccinated and rates and hospitalizations as high as they are?
Yeah, so as both the governor and Director Bookman have stated, we really do continue to see this as a pandemic of the unvaccinated. It really, the hospitalization rates we're seeing, the case rates we're seeing, the death rates we're seeing are really incredibly higher among our unvaccinated population than our vaccinated population. Just one statistic would be that for unvaccinated individuals, the risk of hospitalization is now somewhere between 8 and 20 times what it is for vaccinated individuals. And then I also showed the vaccine effectiveness numbers that, you know, except for our oldest Coloradans, we really see the vaccine effectiveness for preventing hospitalization and death in that 90, 95 plus range. So, I mean, we're really seeing incredible protection from the vaccine for our population. We know that for older Coloradans, the risk of waning immunity is greater. And as the governor said, that's the population where we really want to see booster doses given. But of course, they're important for younger folks as well.
And let me put an exclamation point on that. We're at about 80% with at least their first dose of adults, high 70s protected. If we were at 95, 96, 97% vaccinated, we wouldn't be having this press conference. We wouldn't be talking about our hospitals, and we would no longer be in a pandemic.
Hi, Governor. Dave Perry with the Sentinel. Thanks for taking the call. This may be for Dr. Herlihy. From contact tracing or other sources, is there a sense of where the bulk of these infections are now coming from or how they're occurring? And I was wondering, are the sources of infection the same for vaccinated people as they are for unvaccinated people?
Yeah, so it's a great question, and it is challenging to answer with public health surveillance data because most people really have multiple exposures. And I think that's probably more true now than it has been throughout the pandemic. As the governor said, the risk to an individual that's unvaccinated now is greater than it has ever been. And some of that has to do with the fact that people are out and about and moving about, and especially for vaccinated people, have gone back to living their lives. We know that restaurants are open. People are going to restaurants. People are going to bars. So all of those activities are potential places for individuals to be exposed. And we know that the risk of those activities is incredibly higher for individuals that are unvaccinated than it is right now for people who are vaccinated.
So look, I get it. There's people that don't want to get a vaccine. Get over your hesitation and get protected. This is the most dangerous period if you are unvaccinated, and only you have the ability to end that risk and substantially reduce the likelihood that you'll be hospitalized or die. Next question.
Hi, this is Kim Posey at Fox 31. I have questions about the monoclonal antibody treatments. I'm wondering if you have any numbers from yesterday, how many people were treated, how that process went. And I just wanted to clarify, did you say that this treatment provides a 70% reduction in risk of hospitalization? One more clarification I need. I think at one point the governor said 1 in 51 Coloradans are contagious, and then another point might have said 1 in 53. Do we know which it is?
Yeah, so let me get that. Rachel, could you address the efficacy of the monoclonal antibodies, please?
Yes, and the prevalence value is 1 in 51 right now. The monoclonal effectiveness, so the clinical trials and the studies that were done for authorization of the monoclonal antibody products do show 70 to 80% effectiveness at preventing hospitalization or other severe disease outcomes.
And if I said 1 in 53, I misspoke. 1 in 51. And then we are working on what kind of the dashboard might look like about the deployment of them. This is not new, to be clear. We are talking about them because we want more people to know about monoclonal antibodies. We want more people to get tested early and identified early, because this is not an effective therapy if you are sick enough where you have to be hospitalized. This has to be given early in the course of infection when you have mild to moderate symptoms and you're at a particular risk of hospitalization. So that's why we're trying to get the word out. And Scott, do you want to talk about the dashboard plans for that or how that'll be presented?
Yeah, we're still working on exactly what that is going to look like. But the bus that just came on yesterday, we're working on that referral process. And like the governor said, we're trying to get as many providers recruited to join us in this effort to ensure that people can receive this treatment wherever possible.
And again, we also want to make the point, it is not nearly as effective as the vaccine in preventing hospitalizations or deaths in any age group.
Next, we have Jesus Carrascal from Univision.
Hello, Governor. In Spanish, Gobernador, ¿cuál sería la estrategia para distribuir las vacunas de COVID-19 entre los niños de 5 a 11 años y si luego de recibirlas podrían asistir a la escuela sin el cubrebocas?
Los tapabocas son una de las herramientas para luchar contra el COVID-19. Aun cuando tengan la vacuna, el CDC todavía recomendaría que continúen utilizando un tapabocas para ese momento. Es nuestra esperanza que de aquí a la primera ya tendremos suficientes personas vacunadas que no será necesario.
Governor John Frank here. Yesterday in your budget proposal, we didn't talk much about COVID. I didn't hear that in some of your priority line items. Can you talk about what new programs you're going to be proposing in this new budget and how you're using federal stimulus money to continue to battle the pandemic? Thank you.
So I think you're asking about kind of COVID in the budget. Our COVID response is well funded. It's well funded largely federally through FEMA, through direct revenues in the CARES Act and ARPA. For instance, the school testing program is a dedicated revenue source for that. Many of our expenses are reimbursed by FEMA. In addition, the legislature provided, John will have to check the number, but if memory serves me correctly, $200 million for the emergency fund, which we utilize on a cash flow basis for funds that will be reimbursed by the feds, but also for the relatively narrow number of COVID-related items that are not subject to reimbursement. So I think, did that answer your question, John? Or is there more to it?
I'm wondering how you're spending new dollars, if any, the extra state dollars on COVID response. Thank you.
Yeah, so a lot, the 200 million in the emergency fund is being deployed for things like testing, vaccination clinics, much of which will be reimbursable by FEMA, some of which might not, and will ultimately be paid for out of that 200 million for public health expenses that was forwarded. I would say at this point, COVID it has a higher prevalence than we would have liked, obviously through the holiday season. It's possible that there could be additional expenses, but they would not be of that same level. We do not expect anything like an additional $200 million request. Depending on where FEMA reimbursements wind up, there could be additional needs in the low to mid tens of millions for the state COVID response. Our priority is saving lives and ending the pandemic. And we know that Coloradans on all sides of the aisle would agree that is the most important thing for our economy and our way of life to get done.
Governor, the orders that you're now putting in place around hospitalization are all reactive. Why not take proactive orders? Why not take steps to prevent new infections instead of trying to increase hospital capacity? And I also want to ask, this is probably the most frustrated tone I think we've heard from you in months. I wonder if you can talk a little bit about, how you're feeling at this point in the pandemic.
Well, I'm very frustrated. And I'm frustrated because unlike a year ago, where we were all in this together, and we had great sympathy for anybody afflicted, and we were all wearing masks to protect one another. Now's the time where most of us are protected, and yet the 20% that haven't yet chosen to get protected, are putting themselves at risk, which you can certainly argue is their own business. And I, have no qualm if they have a death wish, but they're clogging our hospitals. And I think most Coloradans are sick and tired of wearing masks to protect people who don't seem to want to protect themselves. So I'm really calling upon everybody to who hasn't been vaccinated, to take a new look at it and make that decision to get vaccinated. I mean, you've been putting it off for whatever reason. You see our hospitals filled with people who are unvaccinated of all ages. You see that almost no one is dying who's young and healthy or even middle-aged who's vaccinated, and yet people are still dying by the dozens who are unvaccinated. I just don't know what else you need. We've made it easy. Get protected. Let's end this thing. And then it's no longer a discussion about being reactive or proactive. With regard to some of the mitigation measures, of course, wearing masks indoors around others helps protect those who are unvaccinated. But again, the patience of most Coloradans is wearing very thin about why we should keep wearing masks just to protect, the 20% of folks who haven't taken a simple step to protect themselves.
Hi, Governor. Karen Morfitt with CBS 4 here. I know you keep saying this is a pandemic of the unvaccinated here, but are there other factors that are causing this jump here in Colorado? And I know this is kind of expanding on what Jesse just asked, but is not having a mask mandate, us being at full capacity, the cold weather? Are there other things that are causing this jump besides people who are not vaccinated? And are we going to see more overflow hospitals in the future?
So first of all, if you look at the prevalence of the virus, this is our region that is affected right now. So it's New Mexico, Colorado, Utah, Wyoming, Montana, the Dakotas. That's where that's hitting. This slice of the country, just as at different points in time, it's hit others. Frankly, you see different types of mask policy in different states, and you don't see hugely different outcomes. Masks in New Mexico, no masks in Wyoming or Utah. You have areas of Colorado that have it and some that don't. Here's what masks can do. They can slow down the spread of the virus. But if you get the virus, whether you were wearing a mask or not, it's just as deadly if you're unvaccinated. So I don't want unvaccinated Coloradans thinking that wearing a mask is somehow a substitute for getting vaccinated. First of all, it's less effective. It's about, the studies vary, but it's about 50% effective, reduces transmission about 50%. Vaccines, upwards of 90%. But just as importantly, if not more, if you're wearing a mask and you get COVID and you're unvaccinated, you have the same chance of hospitalization and death than if you weren't wearing a mask. Whereas if you're vaccinated, your risk goes down to 10 to 20 fold, right? Like 0 people under 40 who've been vaccinated have died since July, and like over 30 who've been unvaccinated have died. And you take it to that next group, 40 to 60, it's almost as stark. We've lost a few people who are vaccinated, I think 13, but 153 who are unvaccinated. So yes, wearing a mask can reduce the rate of community transmission, but don't think you've dodged a bullet just because you wore a mask this month if you're unvaccinated. You will probably get COVID in December, in March, in April. This will become endemic. People will die after the pandemic in the endemic stage, just as people die of the flu and of measles and of other conditions that we are able to make great progress in preventing through vaccines. So you haven't dodged a bullet just by getting through this period. You still need to get vaccinated.
Governor Michael Deovana with KUNC Public Radio. Why do you think COVID prevalence and hospitalizations, why is this rising in Colorado when it's on the decline in other states? What do you know? What are the experts and your peers telling you?
Well, and I'll let Dr. Hurley address this. That I think there's just not a scientific consensus on that, but I'll let her sort of say what that is. But I would say that for whatever reason, our region of the country, the Mountain West and the Upper Midwest, is experiencing a significant rise in COVID-19 right now. Colorado did not experience the rise when other areas of the country in summer did. We actually saw a plateau and decreases. Those areas have come down. The Upper Midwest and the Rocky Mountain region and the Southwest are now increasing. So this hits different areas at different times. One thing is sure, the level of the vaccination rate that you have in your state or your county affects what that peak is. Areas that have lower vaccination rates are going to peak out at a much higher COVID infection rate. Areas with higher vaccination rates are going to peak out at a lower COVID infection rate. But I don't think anybody, at least nobody, has told me with any degree of confidence why, Florida this week and California this week and Colorado this week and New York that week. Dr. Hurley?
No, I think you're absolutely right, Governor. The only thing I could add to that is that, I think it's probably more than a coincidence that this is the exact time we saw an increase last year. This increase did start a little bit earlier than our increase last year, our fall wave of illness, but very similar. When we're looking at the projections for our peak in hospitalizations last year, it was the same thing. It was late November, early December, and that's again what we're forecasting right now. So I think there is something with seasonality, human behavior. It's hard to know. Is it temperature? Is it humidity? Is it human behavior when the weather changes? It's hard to really know exactly what it might be, but it does seem like there is some element of seasonality going on here. And we see that with other respiratory viruses as well, right? We see a flu season, another respiratory virus season. All of those viruses typically peak in the late fall, early winter.
Our next and final question will be from John Daly.
Hi there. Thanks for taking our questions. I wonder if you could speak a little bit to the impact that these high levels of hospitalization are having, especially on folks who may need to go to the hospital with something other than COVID, and what kind of care can they expect? What impact are these high levels of COVID hospitalizations having on the care, basically for anybody who might get hospitalized if you were in a car accident or had a heart attack or whatever?
Yeah, it would not impact anybody who is in a car accident or who has a heart attack, but there are Coloradans who are making medical sacrifices, meaning people who had scheduled knee surgeries, back surgeries. The hospital has to reschedule those because they don't have the staff to do it. They're saying, we wanted to fit you in early November, and now we can't fit you into early January. So a lot of those, sometimes they're called elective procedures, but that is too broad a term because they're really medically important procedures. They're just procedures that can be delayed. Many of them are being delayed at times in certain places by some hospitals. So that is occurring, but this would not affect anybody who has a heart attack or stroke and who needs a bed. We're at about 90%. We're not at 100%. We're also not at 70% where we normally have been at this time. We're at 90% capacity. That also means with the variability, some hospitals might very well be at 97, 98, others at 83, 84. That's why we've taken the steps to be able to route patients to hospitals that have more availability to make sure that that the hospitals that are more full have the ability to take somebody who's in a dangerous, deadly car accident, across the street from that hospital. Thank you all very much for your time. Stay safe, get vaccinated, get protected. Let's end this thing.